Hi, good morning, Roby. My name is Emily Hudson. I'm your invigilator for the OET speaking session on the 15th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Roby David.
And what is your candidate number, please?
My candidate number is 201202532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What would you do if you discovered you had made a medication error?
If I discovered that I made an error with a patient's medication, I would begin by notifying my supervisor, and then I'd notify the patient and their family. After notifying them, I would notify the rest of the care team and report the error to the hospital safety committee.
Workplace stress is quite natural. How will you overcome workplace stress?
I deal with workplace stress well. I set boundaries with work. If a day is particularly stressful, I try to take breaks, to go outside, and decompress with a short walk. This way, I am refreshed, and can come back, without feeling overwhelmed.
In short, tell me, what are the best and worst things about being a nurse?
I believe, the best thing about being a nurse is being able to provide excellent customer service and care. The worst thing about being a nurse is watching a patient's health begin to decline because their illness isn't getting any better.
Every person is different. So, how will you manage a tough patient?
I would start by making sure that the patient didn't have any valid complaints about their health or my care. If there wasn't anything I could personally fix, I would then remain calm and empathetic. And do my best not to take it personally. Rather than treating him or her just as a patient, I will do my best to connect with him or her as a human. I would talk to the patient, not just at him or her, but to build a social bond.
Can you claim you're a team player?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team, because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating, and am equally comfortable working alone.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Good morning. My name is Roby David. I'm one of the nurses working in the clinic. May I know your name for the record, please?
Good morning. My name is Emily Hudson.
Hello, Emily. May I know what brings you here today?
I am concerned about my menstrual cycle. Although it is irregular, it has been delayed more this month.
Oh. I see. For gathering more information, shall I have a few questions?
Sure. You may please.
May I know your marital status, please?
I am newly married, just 3 months before.
Okay. So, can I know about your last menstrual period, please?
It was about 30 days back.
All right. Do you have any troubles other than missed periods?
Yes, nurse, I am feeling dizziness and tiredness.
Noted, Emily. Are there any other difficulties you have noticed?
Yeah, recently I have noticed some sudden mood swings.
Okay, do you have any changes in your appetite?
Yes, nowadays I feel very reluctant to eat, and also, I cannot stand certain foods' smell.
All right, Emily. So far from the symptoms that you have explained, it is suggestive to the signs of pregnancy. Therefore, to clarify pregnancy, you must undergo some pregnancy tests.
Oh. Is it? Are these signs of pregnancy?
Yes, during the first trimester, I mean the first 3 months of pregnancy, you may feel signs like tender, swollen breasts, nausea with, or, without vomiting, increased urination, fatigue, food cravings and aversions, heartburn, and constipation. Along with all the physical symptoms, you may even experience some psychological changes. But there's nothing to worry. These are very common during pregnancy.
Oh, I am really grateful to know all these. Thank you.
You are welcome. By the way, it's necessary to undergo a urine pregnancy test for the confirmation of pregnancy.
Shall I do it in the hospital itself?
You can either do it in the hospital or by yourself at home using a urine pregnancy kit.
Yes, I have heard about it.
Good. So, after the confirmation, you have to book an appointment with our gynecologist for further checkups.
Sure, I'm ready to do a test at the hospital today itself. And kindly help me to book an appointment with the gynecologist by tomorrow.
Of course, I can make the necessary arrangements.
Nurse, if I am positive for pregnancy, what all things I should be aware of?
Don't worry, I can explain regarding the do's and don'ts during pregnancy.
Nurse, I am elated to listen.
First of all, you should eat a diet high in fruits, vegetables, low-fat forms of protein, and fiber. Eat enough calories, about 300 calories more than normal. Drink lots of water. Take prenatal vitamins as per doctor's order. Do small exercises regularly. But, do avoid strenuous exercise, or strength training, that could cause an injury to the stomach. Are you following me?
Yes, I am.
You should avoid alcohol, smoking, use of illegal drugs, etc., if you have any. Caffeine can be consumed, but not more than 1 cup of coffee or tea per day. Avoid raw fish or smoked seafood, including sushi, shark, swordfish, mackerel, or white snapper fish, as they may have high levels of mercury. Stop drinking unpasteurized milk or other dairy products. Is it understandable?
Yes, nurse.
Good, all right. Is there anything that I need to address?
No, nurse, you have cleared many of my concerns.
Happy to hear that. However, I can also provide you with a brochure, which contains all the information regarding pregnancy and its care. I hope that will help you a lot.
Yes, nurse, that could be really helpful. I'm really grateful for your service.
I am glad to know that. See you tomorrow during the appointment. I wish you a happy pregnancy.
Thank you.
You are welcome.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.